Everyone, thanks so much. Thanks so much for joining us for our Center for Mental Health Services Research Seminar. My name is Byron Powell, and I'm the co-director of the Center for Mental Health Services Research, along with Leo Kabasa. And we are thrilled today to welcome a friend and colleague, Dr. Bo Kim from Harvard. Bo is a mental health services researcher and an implementation science at the VA Center for Healthcare Organization and Implementation Research, or QUERI, and an assistant professor of psychiatry at Harvard Medical School. She earned her bachelor's through doctoral degrees in electrical engineering and computer science from MIT, then completed postdoctoral fellowships in health systems engineering and health services research at the New England Veterans Engineering Resource Center and QUERI, respectively. Her research interests are in applying interdisciplinary methodologies towards studying the quality and implementation of mental health services. And she currently directs the evaluation core of the VA Behavioral Health QUERI, or Quality Enhancement Research Initiative program, and is the systems analysis lead for the implementation core of the VA Bridging the Continuum, QUERI program. And since earlier this year, she has been serving as a chair of the new investigator network of expertise for the Society for Implementation Research Collaboration, and is also an associate editor for CERC's journal Implementation Research and Practice. I was really thrilled to see that, Bo. So congratulations on that role. Bo is also a former fellow of our Implementation Research Institute that many of you are familiar with through the CMHSR. And honestly, is probably the kindest, most positive person I know in the field. If you're ever giving a presentation, you want Bo in the audience, smiling at you and listening attentively. She's fabulous. And really excited to hear her present today on systematic decision-making for using technological strategies to implement evidence-based interventions. Thanks so much for joining us, Bo. And I'll just say, please put questions and comments in the chat. And I think this is informal, so Bo, if folks have clarifying questions, I think they can feel free to jump in now, and we'll look forward to it. Thanks again for joining us.
Thank you so much for the introduction. And I'm going to try to pay attention to the chat box, but in case I miss something, please jump in and remind me to stop and answer the questions that might be popping up. And so thank you again for this opportunity to share our work here. I'm going to try sharing my slides from this end. Please let me know whether they show up.
Perfect.
Great, thank you for confirming. All right, so thank you again for this opportunity. And the topic that I would like to think together with you about, as Byron mentioned, is on technological implementation strategies and the different considerations that go into deciding whether and how to use technological implementation strategies to promote the uptake of evidence-based practices. So we'll unpack what I mean by all of that just in a second. But as we get started here, I just wanted to mention that I have no conflicts of interest to report in talking with you today, and all the views to be shared are my own and those of my collaborators on this work. Speaking of collaborators on this work that I'll be talking about today, I was especially looking forward to sharing today's topic with you because our team is one that formed as a part of the Implementation Research Institute Fellowship that Byron mentioned that I was so fortunate to be a part of. And it's, of course, housed here. And Dr. Sarah Wilson, who is at the Durham VA and Duke, and Dr. Jessica Breland at the Palo Alto VA and Stanford, and I are members of the same IRI fellowship cohort. And we formed the ideas, many of the bases of the ideas that will be shared today over quite spicy noodles that we were eating right outside of the Washington University campus. And so, we're really excited about this. And here also are some we'd like to acknowledge the support that we received for this work as well, of course, from IRI and our funding sources. So thank you again for the opportunity to share this. Let's jump right into it then. So technology, as we know, shapes every single part of our lives these days, and they definitely shape interventions as well as strategies for implementing such interventions into routine clinical care practices. So on the technological intervention side, it's really receiving a lot of attention, right? They are undergoing enhanced specification about how much technology is involved in, let's say, a certain type of behavioral intervention technology. And then they are really being actively studied and specified and evaluated and categorized as well. So some of our close colleagues, they talk about, for example, websites, software, mobile apps, and sensors that might be used as interventions. And they also specify the cases in which technology either plays a quite assistive role, where still the intervention is very human delivered, and all the way on the other end of the spectrum, interventions that primarily themselves might be very much delivered by the technology alone. So that kind of specification is really being increasingly popular, I think, on the intervention side. And now such kind of specification is not yet quite available on the technological implementation strategy side, including when and how to use them. So before we go any further, I thought it would be interesting to be able to say, what do we mean by technological implementation strategies? So many syllables there. So many of you may be familiar already with the widely used definition of implementation strategies by Proctor and colleagues, which is that implementation strategies are methods or techniques to enhance the adoption, implementation, and sustainability of a clinical program or practice. So what we did was we took that definition and then we merged it with the definition that the World Health Organization uses for e-health. And their definition of e-health is the use of information and communication technology in support of health and health-related fields. So we put those two together, and by merging the two definitions, we arrived at our current working definition of technological implementation strategies, which are methods or techniques that use information and communications technology to enhance the adoption, implementation, and sustainability of a clinical program or practice. So let's talk a little bit about the role of technology and implementation strategies. So technology can really improve implementation strategies, let's say efficiency. They can simplify tracking of progress, and they can really remove distance-related barriers. Like, I feel so fortunate to be able to call into and share this work with you today because we are able to use this technology, right? So for example, virtual implementation facilitation, which is becoming very popular, uses this kind of telecommunication to be able to have an expert on the intervention and the implementation process, be able to work with an implementation site to be able to implement a clinical practice. And that minimizes the need for the expert to have to necessarily in person travel to the implementation setting. And then another example might be electronic audit and feedback. So in which case it's the performance on what is supposed to be getting done is audited, and then that is fed back to the people who are supposed to be doing that. So if it's an implementation of an intervention, an evidence-based intervention that is meant to be used by clinicians, the clinicians are being told and being fed back whether they indeed are using the interventions that's being implemented and that are meant for them to be using. So that, as opposed to, let's say, verbally or by paper delivering that feedback, can really speed the implementation. It can also speed the implementation and understanding of what exactly is being done. So those are some examples of, again, quite mildly involving technology, but definitely involving technology types of implementation strategies that are often a part of efforts nowadays. And as technology advances, and as the implementation science field also advances, it's really seeking different kinds of implementation strategies and innovative ones at that, right? And so there are increasing opportunities, and there will be more and more as we move forward, opportunities for new technology to take a role in implementation strategies. But I think this is where we wanted to remember that more is not always better, in the sense that technology is of course, it can be a countermeasure to, let's say, health disparities by allowing better access to healthcare to those who might not have had that kind of access without that technology. But at the same time, it can also be a potential threat, right? That further exclude certain populations, especially those without access to the technology itself that would be needed to benefit from an implementation strategy that uses that technology. So incorporating technology is meaningful, therefore, only if the resulting strategy can be both usable, in other words, it's easy to use, and also useful, so that it really helps improve the performance, the quality of the type of implementation that is happening. And on top of that, further making matters more complex is that what is usable and useful is different in different contexts and implementation settings. What I would actually like to try here is a little bit of a group activity. I know it's later in the day, so hopefully this can break up some of what we discussed today. So it's called a chat waterfall. And especially with a lot of these Zoom meetings that we have and seminar sessions that are being so prevalent these days, some of you may have used this chat waterfall activity before or been part of one. So this is how it works. When you're asked a question today, so I'll ask a question, and then please type your answer into the chat box. Again, no wrong answers, of course. So, any answer is really fine, anything that comes to mind. So you type it in, but you don't press enter yet. And then after some time, after I'll give you some moments to think and type, and after that I'll say 3, 2, 1, and go. And when I say go, then everyone presses enter at the same time. So that's why it's called waterfall. And let's give it a try. Again, no wrong answers. Let's try this on a practice question. And if it turns out that this activity is not usable or useful in this particular seminar context, we will promptly decide to not use it and follow our own advice about trying to incorporate new ways of doing things. All right, so given just the limited amount of what we've just talked about, the question that I'd like to pose, this practice question, is what technologies or technological implementation strategies, if you're already very familiar with them, might be useful and usable in one context, but not in the other. So can you think of examples where it would be useful in one context and not in the other? Examples of such technologies. So I'll give you a few moments to be able to think of an answer. And if you can type into the chat box your answer, but wait on pressing enter. And if you have questions about the question itself, please chime in and ask, of course. All right, we're going to just give it a few more seconds. All right, so I'm going to say now, 3, 2, 1, go. So please press enter. Let us see your answers. Thank you. Thank you for typing in. And let's take a moment to look at what some of these answers are. Yes, definitely behavior change apps, telephone apps, a lot of apps, definitely, yes. These could be very useful in some settings and not in others. Audit and feedback, as we've been talking about, definitely this is the case. EHR, true, the use of the EHR, and actually a case example that I'm going to talk about later has to do with the EHR, so we'll talk more about that too. Yes, I see those. I totally agree that some of these make a lot of sense. Rebecca, if I may call on you.
Sure.
So for the behavior change, hi.
Hi.
For the behavior, nice to see you again. For the
My
behavior
cat is
change
too
app.
close. Sorry, I was
Did
just
you
saying my
want to say a
video is
little
not on, but go ahead. Yes.
Yes, for the behavior change app idea that you typed in, what were you thinking in terms of the context in which it works well versus less well?
So I was actually thinking about apps that would help with obesity. And if you're in an environment where the recommendations are there, like you have access to healthy food and exercise, then it would work. And if you are in a place where you don't have those things, then it's not really useful or usable to be tracking things that you structurally don't have access to.
Yes, I think that's very true. And as an implementer, as we go in and try to implement things, trying to learn about what kind of resources and what kinds of infrastructure and structural things actually already exist versus not, that would all play into the decision of whether or not an implementation strategy that uses a technology will be meaningful to use. So thank you. Thank you for sharing the thoughts on that. And if I may call on Tanya as well, you mentioned telephone apps. Would you like to share your thoughts on where you were coming at this from?
Yeah, I was thinking about some of the costs that come with texting for people, and also contexts like prisons where you're not allowed legally to have telephones, and so just the different kinds of settings. Or with intimate partner violence, there have been some advances in the use of apps, but then there are also challenges with partners who control access to phones or monitor your phone activity. So those were some of the things that came to mind.
And thank you very much for sharing that thought process. It's very true, kind of the context in which the people who need to be using these technologies, what kind of situations they are in, would definitely impact whether the technology can be usefully used after all. So thank you for sharing that thought. All right, we'll come back to, and hopefully the point of using these chat waterfalls also is to be able to keep a record of all the great ideas and thoughts that are being shared. So hopefully we can continue to use this, and I think it went okay. We will see. We'll continue to see and be vigilant to whether this chat waterfall thing is working. And also, if you come up with questions that you would also like to solicit input from other members who have joined our discussion here today, please feel free to suggest that as a chat waterfall question too. It's a good way to sort of give a little bit of a moment for people to think about how to provide their thoughts and share it all at once. Hopefully with the momentum, it helps to be more interactive that way. So we really need to systematically, therefore, given all the things that we were just discussing, assess whether a technological strategy can indeed be usable as well as useful when you're using them. So this assessment is really needed before you decide to use that strategy. And looking at the slide here right now, we generally want to be able to be convinced before using that we want that technological implementation strategy to be easy to use, and also has the potential to bring about much improvement in the way that implementation is carried out. So, for example, this reminds us a lot, and which is why we decided to adapt this way of visualizing. This reminds us a lot of the effort versus impact visualization that is widely used in operations planning and often now in healthcare quality improvement as well. And the idea is that you think about taking a potential action, and in this case, using an implementation strategy that involves a technology. You think about that potential action in terms of, does it require a little effort, which will then bring about a lot of big impact, which is on the left top corner, or does it require a little effort and also it won't make much of an impact, and that'll be on the left bottom corner. And then is it requiring a lot of effort and also has potential to make a big impact? That's the top right corner that you see there. And then, of course, some efforts could take a lot of effort, but it might not be likely that they can make a big impact. And that's the right bottom corner. So this combined consideration of both the effort that it's going to take to use an implementation strategy that involves technology, and then the impact of making that technology be incorporated into the implementation strategy, it helps serve as a rubric for deciding whether and how to pursue the action. And in our case, as I mentioned, the action refers to the using of the technological implementation strategy. So this method of like effort versus impact, you may have seen it in other contexts as well. It is widely applied, as I was mentioning, and it's really underpinned by strategic management concepts. So when there are many things that you can choose to do, or there are many pathways from going from where you are now to where you want to reach, how do you prioritize? How do you decide what might work well? And so much of that could be dependent on both kind of as the implementer or as the researchers knowing what needs to be done, plus understanding what's most appropriate for the setting in which the implementation is being carried out. So for the electronic audit and feedback example, which we talked about a little bit, some of the effort considerations could involve potential time and resources that are needed to, let's say, install the software for doing that kind of a feedback. And then also time and resources that are needed to train healthcare staff that would be using that software, right? And then also alongside that, the impact considerations, what could possibly come of using that? The impact considerations could involve a potential increase in staff awareness of exactly where the implementation is and how it is progressing, which in turn could then encourage better movement upon kind of the plans that have been put into place in implementation, knowing that they still need to go a certain distance or how well they're doing could be positive feedback, et cetera. So there are advantages and impact that could come up using this type of a strategy. And so, again, let's try another chat waterfall here then. What might be other potential efforts or impacts of using electronic audit and feedback? I put electronic audit and feedback just because we've been briefly talking about that as an example, but it's fine if you would like to think of a different technological implementation strategy. So what might be other potential efforts that are needed? Or if you want to talk more about how it could impact, better impact, let's say, the implementation, you could write that too. And while you're typing the answer to that, just as a reminder, audit and feedback, as I mentioned earlier, it involves systematically reviewing performance. In this case of, let's say, how clinicians are, let's say, using an evidence-based intervention and then feeding that information back to them so that it hopefully encourages them to use the intervention even more. So with that in mind, please type in thoughts about what might be other efforts that are needed to make this implementation strategy that involves technology work, and or what kind of impact could it reach? We'll give it a few more seconds, maybe 10 seconds more, while people are hopefully typing. And please feel free to ask questions about the question as well, of course. Right. Let's do a countdown then. We're going 3, 2, 1, and go. Now please enter your responses so that we can all see them. Thank you. And let's all take a look at the chat box and see what our colleagues have put in. Oh, hi, Nola. I'm sorry, my screen was not on the participant side. Didn't see you sign in earlier. Hello.
I'm cheering you on.
Thank you. So yes, of course, the fatigue, ease, boredom, all of that time. It takes a lot of time. Especially with feedback, they could definitely start ignoring it after a while, especially if it becomes either disruptive or too common. Yes, they have to pay attention to a lot more, potential for burnout. I see another kind of staff burden as related to that. Yes, for sure. And stakeholder buy-in, budget, big issue for sure. And I think that's another big reason why we need to keep in mind involving stakeholders and understanding where these implementation strategies could go. And yes, as an impact, thank you for mentioning the expanded reach, for sure. So if we're able to kind of keep track of where the usage is and be able to use that information, it could be an encouraging way to trigger further action on the implementation front. So thank you for those ideas. Right. So drawing on that effort versus impact assessment approach that we just talked about, we sort of delineated a three-component, I think relatively expected and straightforward, I would say, approach to deciding whether and how to use a technological implementation strategy. So the components that are shown here are, so component one, you want to be able to assess the effort that's required, just like we're thinking right now, right? Really actively about the effort that will be needed. And then you also want to be able to assess the strategy's potential impact. So yes, it might take a lot of work, but what is it going to get us? And then based on what you get from those assessments, you want to be able to come to a decision as to whether or not to use the strategy at all, or are there ways in which the strategy can be modified so that it can be used in, again, an appropriate, usable way. Before initiating that kind of a three-component approach, we thought that there is, of course, some preparatory work that needs to be done. So first, being really clear about what technological implementation strategy is actually being considered is very, very important to do. So, for example, following Proctor and colleagues' framework for naming, defining, and specifying the strategy can be considered. And this kind of specification is what enables the next piece of preparation, which is to really ensure that all the stakeholders, so in other words, everyone who might be impacted by or will be impacting the technological implementation strategy are kept in the loop and having input into the decision. And also therefore having a very shared understanding of what exactly the strategy being considered involves. So if we consider this electronic clinical reminder as an example, then the specification really would include things like articulating what the triggers are, what triggers the reminder, how often does it happen, for whom, and then of course, which actions actually qualify as attending to this clinical reminder. So being able to make those specifications, we thought, are very important as preparatory steps. And then speaking of stakeholders, we also wanted to point out that through every component of the three-component approach that we're talking about here today, that it is really important to involve them comprehensively throughout each component of the approach. So each component should really try to directly understand from them what kind of effort they think is required, as well as the impact that they foresee. And then continuous input from them throughout making the decision is important. So some of the things that come to mind for me are people who are going to be using, of course, should be involved in this conversation, but importantly, the decision makers also need to be involved in this type of a conversation, just because they might be the ones signing off on whether a technology training can be moving forward or not. And then as you are thinking, and as you're especially connecting with stakeholders, sometimes it might be difficult to say, how much effort does it take? Tell me. It might be a difficult question to answer. So these are the times when it's actually very helpful to be able to go to stakeholders with some alternative strategies and be able to say more effort or less effort compared to what. And those alternatives might be involving technology, or they might be more traditional methods that don't involve technology, but that gives a sense of what the comparisons can be anchored on, and therefore have a more lively discussion, hopefully, of what is expected effort and expected impact when it comes to considering technological implementation strategies. So the next chat waterfall is who all might be considered to be stakeholders who might potentially impact or be impacted by the use of a technological implementation strategy. So I gave a couple examples, right, of potential users are definitely stakeholders. We talked about people who are making the decisions in a healthcare system. They definitely are stakeholders. Are there other stakeholders that we should be keeping in mind when we're thinking about whether a technological implementation strategy is appropriate to use for implementing an evidence-based intervention into a clinical setting? Let's take a few seconds to type in our thoughts. Give it 5 more seconds. All right, let's try this again then. It's 3, 2, 1, and go. Right. Thank you for your responses. Let's look at them together. Definitely, clients, funders, excellent point. Yes, the legality of, especially when it comes to communication-related technology, I think it's very important to think about privacy protection, confidentiality. So we need to get those people involved for sure. And definitely team members who might not have access to information. Excellent point. And data about the implementation. So they need to understand what they and how their work might be impacted as well by this implementation. IT staff for sure. Who's going to be involved in making sure that people can use the technology if they're going to be leveraging that technology for implementation, for sure. So clients, IT staff, administrators, yes, decision makers for sure. Thank you for these ideas. And I think these are exactly the types of things that we want to keep in mind as we're speaking with involving the people who need to be involved in the decision making here. Let's talk about the components then. So the first component really focuses on trying to answer how available is the technological infrastructure that is needed for using that as an implementation strategy. And then how familiar is that technology already to potential users? So if they're already very, very familiar, then the training component might not be too much of a burden. But if it's not, then of course that needs to be considered as a part of the effort that needs to go in. And in terms of gathering and analyzing stakeholder input, there can be a variety of methods that are used for this. So the choice of methods, see exactly what type of method to use to solicit information and input from stakeholders, it can be really based on the feasibility of what is meaningful and possible to do for the research team and for these many stakeholders, different types of stakeholders to be involved. So the couple things that I listed here are questionnaires, for example, and they could be on a quantitative scale. You could ask them to rate in terms of the effort or the impact, Likert-like scale. You could also hold consensus building discussions in a more qualitative manner, trying to get the stakeholders to exchange thoughts on and decide how much effort and potential impact an implementation strategy involving technology could have. And then, as I mentioned earlier, it's really, especially in those discussions and even when you are administrating surveys for them to answer, it's really helpful to be able to say more or less effort or more or less impact compared to what, so that they can anchor that in their minds as they are providing their input. The second component aligns with actually Shaw and colleagues' 3 e-health domains, and it really tries to answer to what extent would the technological strategy enable either better monitoring, tracking, and informing of implementation progress, or to what extent does it enable communication among implementation stakeholders, or better collection, management, and use of implementation data. So we want to ask those questions in terms of impact. And here, another very, very important point, and we touched on this briefly earlier in today's session, is that to ensure that innovative technologies do not inadvertently increase health disparities, this component also should focus on to what extent the technological strategy might increase, maintain, or help reduce disparities when it comes to having access to some of the evidence-based interventions and their implementation into specific implementation settings. I think I saw a particular question pop up, so let me see. Yes, Rebecca, I see your question. How do you deal with potential change over time in effort/impact when asking stakeholders about this? So are you talking about like at the beginning, at a certain point in time that it might take a certain amount of effort, which could lead to impact, but over time that amount of effort needed and the impact that it's going to have is going to change? Do I understand your question correctly?
Exactly.
Yes. So thank you for kind of previewing what I thought I might mention a few slides later. Actually, we recommend having this kind of a conversation not only at the beginning, but again as the implementation progresses, or if it is getting moved from a pilot implementation place to a new location. I think it's very possible, especially with advancing technology that advances so quickly, as well as people's familiarity with some of these things, and with policies, as you talked about earlier, right, that could change because of situations such as the pandemic and other things. that I think the effort level really is going to change a lot, and therefore, with regards to that, the impact that could be had through that. So I think when you deal with stakeholders and talk about this, it's really about, as of right now, or more importantly, as of the time that the implementation is going to move forward, what is the expected effort and expected impact? And further, like, how are you going to decide when the time comes that that needs to be reassessed? So you kind of set up in advance when you expect a rediscussion of that will be needed. Perhaps it's when it gets spread to different places, as I mentioned, or it could be if a seminal event happens that changes the ease with which some of these efforts can move forward, and also the ease with which some of the populations or other impacts can be reached through the implementation that you're working. Does that sort of answer your question?
Yeah, it does. I guess I just feel like having these conversations, like it would come up. Okay, so what are you taking off my plate if you're adding this to my plate? And is this increasing my work in the short time, and it'll reduce it in the long term, and just like those kinds of conversations.
Yes, actually, thank you for clarifying. I think that is an excellent point that you brought up that I didn't specifically address in my answer to you earlier. Yes, I think there are temporary increases in effort and temporary, I think more effort side, I would say, with hopefully lasting impact. And I think that's something that we want to definitely explicitly bring into the conversation where, yes, when you're picking up a new technology, there's that learning curve. And whether it's technology or other resources that need to be put into place in order to make that technology usable in a setting, there is going to be some upfront effort, which equates to upfront time, upfront resources, et cetera. I think taking that into consideration of the eventual lasting impact that is going to come from making that initial investment, that's the exact type of conversation that needs to be had with the stakeholders. So thank you for clarifying your question. And I agree with you in terms of it's a difficult conversation to have, but it's really in the lasting impact that I think needs to be used to contextualize whether the effort that's being put in temporarily is worth it.
Well, this might be a tangent that you can totally park, and it will probably be poorly articulated. I was giving an implementation science training one time, and there was a Roger Kessler is his name. It sort of broke down the steps of adding something to the EHR, and I was blown away at like the level of granularity that he went into all these people that you have to talk to and engage and pay for their time, which was not cheap at all, if I remember, in terms of who's programming this. And so I guess I'm not exactly clear on the question, but sort of like, even when you think about assessing the impact of those types of changes, given the complexity of like, hey, we don't know what the unintended consequences are going to be. We don't know if this is going to have a big effect or a small effect. Like, how do you think about piloting things, or even, evaluating things like that do take such a huge lift? Even though they kind of seem like, oh, this should be like a simple tweak to the EHR. And I know, I'm probably ignorant to the other aspects of technology that we could be changing. But it seems like a tricky conundrum to me.
Yes, thank you so much for bringing up that point. I think no changes to the EHR, simple, and it sounds like your experience speaks the same. You bring up an interesting point about the piloting, and when it comes to technology, I don't have it included specifically in today's presentation, but when it comes to technology development and piloting to refine and then to further implement and then continuously, iteratively change the design to continuously, dynamically meet the needs of the users, that's actually a big part of, I think, why we want to be able to accurately assess at this point what kind of effort is needed to implement the technology. Now, I think in deciding together with the stakeholders how you're going to roll out that use of the new technological implementation strategy, I think it is very reasonable and probably a must whenever it's possible to trial it at that small scale of piloting to see whether it works, to try that first, and then have, again, an agreement to reassess whether the expected effort that you thought you would spend on this thing actually is equivalent or at least close to the effort that you found the pilot effort spending. And I think that will be very critical before you move on, as is with anything else, before you move it to a larger scale of using the technological implementation strategies at a larger scale. It will be really important to assess that and pilot that and then move it forward. And I think that adheres very much to kind of, some of us might be familiar with, if you think about user-centered design or human-centered design, it really is about, after the conceptualizing of what kind of design something will take on, it's really about being able to prototype it before refining it further, and then only then being able to use it fully. So I think it takes into consideration, it needs to take into consideration those good design steps that are not specifically articulated today, but definitely take a big role in terms of understanding how best to put technology into use.
Thank you.
So what I think would also be helpful to keep in mind, and we wanted to stress when we were putting these components together, is that the two components do not necessarily need to go in order of one and then to two. It can be carried out at the same time if it's, for example, the same questionnaire or same discussion, group discussion that is being used to get input from stakeholders. And then also we wanted to stress, those of us who do and work a lot in implementation, we are familiar with there being many guiding models and frameworks when it comes to implementation. So we really wanted to put together this three-component approach in a way that it can work in combination with existing models or frameworks for implementation. So having such a model or framework that is already guiding work, it does not mean that then, oh, this is yet another thing. Rather, if we have a different framework that can help shape the types of questions that we want to assess about the context or about the recipients, et cetera. And as an example, some of you may be familiar with the Integrated Promoting Action on Research Implementation and Health Services framework. So in that case, some of the main things that they consider to be important to implementation and considerations are context and also recipients, and the facilitation that actually happens for putting the innovation into practice. So in those cases, some of these assessment questions can specifically ask whether the technological strategy would enable better communication, for example, between those who are doing the facilitation of the implementation and those who are receiving the facilitation. And that can really be based on the overarching framework that's guiding the implementation. So some of those questions of assessment can be really helped by having those models and frameworks, and therefore can be used together with this three-component approach. And then there, of course, is the third component of coming to a decision as to whether to move forward with this strategy or not. And you can see on the screen here, we just changed the axis just a little bit from the traditional effort versus impact to really specify that it's the effort needed to make this technological implementation strategy usable, and then the impact that that can bring about. And especially when it is unclear which quadrant a strategy belongs to, because there are differences of opinions or otherwise, it's really helpful to be able to place that alternative strategy that we talk about as well, so that they can be compared alongside one another as to involving that technology being more impactful or more effort needed versus other alternatives. And then, as is, of course, the case for the other components we discussed as well, stakeholder involvement, stakeholder involvement, stakeholder involvement. So it's really important so that they can clarify any previously expressed perspectives as to the amount of effort and impact that is expected out of this technological implementation strategy, and then really collaboratively reach a decision with the implementation team together on how to move forward. I've been talking about these like surveys and questionnaires or discussions to be able to get input from stakeholders. Do you think there are other ways in which we might be able to involve stakeholders to understand from their perspective how much effort a technological implementation strategy would need and what kind of potential impact involving that technological implementation strategy might have? So are there other ways? And from your implementation and non-implementation research hats, I think I'd love to hear some additional ideas that you may have. Let's do this chat waterfall. Give a few more seconds here. All right, thanks for typing your answers. Let's do this. It's 3, 2, 1, go. So what kind of answers, if you wanted to press enter, might there be for involving stakeholders? Direct observation, yes, for sure. Yes, I see that user-centered design, definitely. Other ethnographic approaches. I see your parenthetical point, Aaron. Thank you for asking to clarify the question. Just wondering whether, other than surveying, asking people to rate how much effort or how much impact strategy can be expected to have when it involves technology, or getting them into a room and discussing about their perspectives, are there other fun ways and interesting ways to be able to get stakeholder input and their continued input into making decisions about technological implementation strategies? So you answered, you mentioned not understanding the question right, but I think what you mentioned directly answers that question. So thank you. And demonstrations and pilots, yes, for sure. Because if the stakeholders are able to see what you mean by the strategy and the technology involved strategy that you are asking them to rate, they would be able to get a different experience of it, a more hands-on experience of it, and be able to rate that and be able to speculate on its impact in a different and hopefully much clearer way. So thank you for that idea on the demonstrations and pilots as well. Yes, and especially for direct observation, I just wanted to mention, when it is a workflow of a clinic or what people's day consists of, that will change in implementing a technological implementation strategies. I think especially in those cases, direct observation could be very, very helpful, and these ethnographic approaches as well, where you're able to not only ask them about what they think matters, but be able to really see that in their workflow, a particular type of technological implementation strategy might or might not work well because of the way their processes are set up. So I think the observation piece is super important and could be a very, very important way of gathering input and input from stakeholders that are not just them telling you. So just very briefly, I wanted to leave a little bit of time today to share with you an example of how we applied this 3-component approach. And it was applied to a project that was led by one of the co-authors, Dr. Sarah Wilson. And the title of the implementation project itself is Stakeholder Engaged Implementation of Smoking Cessation Health Services. And it was the point of the project. They really focused, and the reason why they wanted to use this was that they wanted to develop a package of technological implementation strategies to be able to implement evidence-based tobacco cessation at an FQAC, HC. So in this particular case, and I won't go into too much detail about this part, but we combined the implementation mapping methodology that the project was using with this 3-component approach. So specifically, the part of the mapping that designs implementation strategies is where we thought that this 3-component approach would be very, very helpful. So to just give a little bit of background on the setting and the population of the case example, it's an FQAC where 75% of the patients are at or below the 200% poverty level, and tobacco use really remains a major issue there. They treat about 30,000 patients or over that a year, with a large part of that population being of the minority and uninsured groups. And then staff who will be taking part in this implementation really come from diverse educational backgrounds. And then importantly, previously, when they tried to implement smoking cessation interventions, it really did not sustain very well, much due to turnover and ways in which the processes could not continuously move forward without specific individuals who needed to stay there. So shared decision-making was an agreement that the research team as well as the leadership came to, in terms of, we need to decide together exactly how we're going to do this. It's not going to work if you come in and tell us this is exactly what you need to do. So this is why I think the 3-component approach was a good place for the 3-component approach to be used. So a little bit about the intervention itself. Target intervention was the 5 A's, and it's part of ARC's guidelines, and it requires 5 sequential steps of ask, advise, assess, assist, and arrange. And despite the evidence that it really has behind it, there has been low medical provider adherence, especially in certain settings, in terms of picking up this intervention. And in particular, when they have tried this in the past, the assist and arrange steps of the intervention had a hard time. And some of the interesting barriers, for example, also came up when learning about this, was that for the ask step, the pediatric providers especially had a hard time, because when their clients are letting them know about their smoking experiences and challenges, et cetera, they would use terminologies or ways to refer to newer products with slang and other things that make it really difficult for carrying out that step of the 5 A's as well. So as I mentioned earlier, the point of the project is they really wanted to come up with a package of implementation strategies, but for the purposes of what we're talking about today, and especially because we talked a lot about EHR integration earlier, I'll talk specifically about how this was used to integrate or think about the strategy of integrating the 5 A's into the electronic health record. So the reason why the implementation research team, as well as the setting, thought of this as a potential technological implementation strategy is that it was really expected to help with the reminders as to what you need to be doing if you're going to be doing this implementation, and if you're going to be doing this intervention that is evidence-based. And then being able to have that integrated into the EHR felt like that would really be stressing the priority with which the organization is also pushing for this intervention to be taking place. So there are, of course, barriers when it comes to this. As we mentioned in the chat box earlier too, oftentimes if it's integrated into the EHR or as a reminder, it really could be seen as one more thing to do among so many things that need to happen within a provider's day. And then also if there are other competing strategies or competing initiatives, other competing initiatives, then that might take the focus and not this particular implementation of intervention. So for component 1, they had both interviews with staff.
Sorry, I don't mean to interrupt, but just to note, we have about 5 minutes, so just to note it.
Yes, thank you very much.
I'll stay and listen for a long time afterwards, though, if you want. Happy to.
No, we should be able to wrap up in 5. Thank you. So we basically held interviews with staff as well as survey of leadership to be able to ask their thoughts on how much effort they think it'll take. And as you see here, the interviews were on the qualitatively analyzed, and then for the survey of leadership, it was on a scale of 0, not much effort, all the way to 10. And let me just skip over this to talk about component 2, because we can look at the results together for both components. So we did the same kind of interviews as well as the surveys for the impact as well. So really it was asking about how helpful do you think this will be? And we got both the front line staff input as well as leadership's input about how integrating this into the EHR would be helpful. And so when we're actually trying to make the decision as to how to move forward with each of the components of each of the 5 steps of the 5 A's, looking at the data, it really showed that stakeholders, and especially leadership, and corroborated by information from the interviews, they didn't feel that incorporating it into the EHR for any of the 5 steps would be low impact. So they felt that it would be high impact. So that was a good thing to see in terms of wanting to move forward. Now they thought that the ask and the assess steps would be low effort for getting at that high impact, particularly because components of that were already being documented in the EHR. And we talked about how difficult it is to make any changes to the EHR earlier today. So that was one of the main reasons why. We can come back to this slide, but just for time's sake, I'll move on. So putting it in a visual way, this is what it comes to. So for the ask and assess steps that I was just mentioning, where already some components of that are being documented, the decision was to integrate into the EHR as planned, move forward with that as a part of the implementation. Now for the other pieces, although they would have high impact, they were considered to also require high effort. And so in those cases, the use with modification step was put into practice here. So in that case, not only just putting it into the EHR, but making sure there's a dashboard that goes along with it, making sure that there are other trackers that are able to tell people whether it is actually being used and actually being done, so that in doing this, it would actually be able to get to the impact that it is trying to get to, with all the difficulties of additionally needing to document and additionally needing to build it into the EHR. The three-component approach really is a way of trying to get stakeholder input all the way throughout. It tries to assess how and whether to use a technological implementation strategy. It's an adaptation, as you saw, of the effort versus impact method, which is widely used and some of you may be very familiar with already. And again, stakeholder involvement from beginning till end and continuing. And it considers alternative strategies. And again, by placing the alternative strategies visually onto the chart, it can help decide whether some things should be pulled back a bit, some components need to be pushed forward a little more, etc. And then again, the whole point is to be able to support using usable as well as useful technological implementation strategies, and to be able to come to that decision before trying out the implementation strategy itself. Important considerations, we touched on these a little bit already, in terms of technology keeps moving forward. So what is effortful today might not be effortful tomorrow. So it's really important to be able to keep in mind that timely assessments are important, but even for the same setting, or even for when the same intervention is being implemented in a different setting, those same things could always change in terms of effort due to advancements and due to contextual differences. So reassessment is very much recommended. And we tried this, as you saw, kind of grounded in a method and then in one setting. And we were able to sort of use this as an opportunity to define the different components and the steps that need to be taken for impact and effort assessment, and how that comes together as a decision. Now, for future work, we would really like to be able to apply this and see whether other ways of deciding implementation strategies, how they compare to this kind of a relatively straightforward and simple three-component approach, and then be able to show this for different populations as well that could benefit from technological implementation strategies. So that actually brings me to the end of the prepared part of the presentation. And I know I didn't leave much time for questions, but I'd be happy to discuss this further with you. Please feel free to reach out to me at the email address that you see there. Please check out our piece. Our citation is there. And I really enjoyed being able to have this opportunity to talk with you all.
Thank you so much, Bo. That was really terrific. And I'm just looking at this down below. So this is already published. Awesome. Sorry, I missed that earlier. So we can disseminate that article. That's really helpful, and glad to see that. We'll promote that, and appreciate your time today, and also your willingness to follow up with folks if they have questions. So thanks everyone for joining, and we'll see you for our next seminar, which I actually don't know off the top of my head. So
I just put it on the chat. It's December 8th. From 4 to 5 p.m., we have Deidre Anglin presenting Racism and Psychosis, the Role of Social Determinants. So
fabulous. Looking forward to seeing you then. Thanks again, Bo.
Thank you.
Thank you so much for the opportunity. Take care.